All right. So welcome everybody. As I speak, I'm sure a lot of people are already slowly joining in. We hope to see a good number of people. And obviously, this is a very specialized area we are talking about. It's diversity, equity, and inclusion in relation to mental health. And we've got with us three esteemed speakers from different parts of the world, from India, from Philippines, and from Malaysia. My co-moderator is Albert. He's from the Philippines, and I'm Sudeep, the Executive Director for the Center for Global Inclusion. I'm Malaysian, but I'm based here in the United States. I'm from the United States. We have this session today primarily because of the various issues that a lot of people are unaware about when it comes to DEI and mental health. And so I'm hoping that you'll actually benefit from the insights that I shared from my esteemed colleagues. This morning, we had our first session, and it was well received. In fact, a lot of people had picked up a lot of learning, and notes were taken, and good questions. The way we are going to be arranging the session is such a way that we will open first with each panelist to actually present, and after each session we'll open up for a question, and anyone would like to raise their hand, they can even ask orally. And during that time we will then move on to the next speaker, after which then we will move to a plenary where everyone can actually chip in, share their views, their comments, their experiences, and whatever. And if time permits, we also want this to be an opportunity for people to network because there's always very little opportunity to network with people outside in the same industry or the same business. And so this is we hope that by putting you into little rooms, you can actually have an opportunity to discuss on the subject matter of interest to you. And the panelists will also join you, so you'll actually have them there. A little later, you'll be shared their links, and you feel free to share your contacts as well, because we don't want you to just leave the room. It's important to share your name cards in virtually. So we have started the recording on this, and like I said, there's closed captioning available. People who would like to have the slides with themselves and also the recording, feel free to reach out to Jeannie or myself. She'll be sharing the emails, but we will be sharing with all registrants next week. Before I start, is there anything else I missed out, Albert? I think we're all ready, right?
Only to encourage them again to share their comments and questions here in the chat, while the topic of the webinar focuses on 3 country perspectives: Malaysia, India, and Philippines. Wherever you're calling us from, we'd also appreciate learning from you as well, based on your own experiences and insights. So please keep the chat box active, share your comments and questions with us.
Excellent. Thank you, Albert. Okay, so without further ado, we're going to start with, like how we did earlier today, we're going to start with Steph, giving her a perspective from the Philippines angle. And so over to you, Steph.
Yeah, so hi everyone. I can just share my screen first. Yes.
Yes, and introduce yourself.
Yes, I will do that. So everyone can see my screen. Yes. Okay, so hi everyone. My name is Steph Naval. I am founder and CEO of Empath, which is a social enterprise or a high impact company that aims to provide accessible mental health care solutions and services for schools, workplaces, and also nonprofits that are in need of improving their community's well-being. So we're based here in the Philippines, and we have an approach of really changing the mental health care system, how it is here in the Philippines, and being able to partner with schools and companies and workplaces and even nonprofits to make this possible for Filipinos. So for Empath, the idea sparked actually because of the problem that's happening today. So checking out the global problem, around 1 billion people worldwide have been diagnosed with a mental health condition, according to the World Health Organization. Also, they've also mentioned that mental health problems is actually the largest cause of disabilities in the world. Here in the Philippines specifically, at least 17 million Filipinos suffer from a psychological disorder, which in this case definitely spiked up over the pandemic. And the mental illness actually has become the third most common disability here in the Philippines. So in the Philippine context, there are many factors or cultural factors that also affect how mental health is perceived. There definitely still is stigma for in the Philippines, although because of the pandemic, that definitely affected the increase or spike of acceptance and understanding and awareness for it. But we definitely have a long way to go because of it. Part of that social cultural notion about mental health is also when it comes to religious factors, because we're also a very predominantly religious type of country. At the same time, it definitely affects how mental health is perceived or handled. What we'd recommend is that the religious factors and also mental health go in hand. So what do I mean by this? For example, Filipinos, like if someone's going through a mental health concern or mental health struggles, it can connote them as weaknesses, or even when it comes to like, oh, you just need to pray about it, or it will go away, or you're not praying enough in that sense. It's okay to pray, definitely, especially since we're a very spiritual type of demographic or country. But I think it becomes a hurdle or a barrier if what happens is if they use it as an excuse to not seek treatment, for example. So a great example that I usually share about in my talks is that let's say you have a stomach ache or you have a tummy ache, and it's very painful, and sure, you can pray about it. If it goes away, great. Let's say if it doesn't, you shouldn't hold yourself back from seeing a doctor, for example, to be able to address it so they can give you proper medication and everything. So similar when it comes to, let's say, mental health. So let's say you're going through deep depression or anxiety and stress. Let's say you pray about it, and then great if you be able to overcome it. But if it's such a prolonged period of time, it shouldn't hold you back from seeking out a therapist or being able to reach out for others when you need help, and also from experts. So some statistics that I'd also like to share about, I'll be talking about the workplaces and schools also, and also about the mental health law here in the Philippines. So there is workplaces and employees. Actually, 77% of Filipino workers say their job is the main source of their mental health challenges. 1 in 4 Filipino workers have considered leaving their work because of the mental health burdens they face. And what's very interesting is that in the Philippines, there is an assumption, or culturally, there's a denial of that mental health concern. Because usually culturally, the coping mechanism would be through humor or just laughing it off, but they don't realize the underlining harms that it causes when they just, I guess, sweep things under the rug in that sense. So that's something very interesting about with Filipino culture as well, but they don't recognize that actually majority, let's say 77%, are having difficult times in mental health challenges. And not only is it such a rise of a dominant concern and urgency, but the treatment gap is very severe. So it's around 90% treatment gap for those in need of mental health care in Southeast Asia. So it's an alarming thing, and there's a lot of opportunity or work to do definitely when it comes to being able to have mental health care accessible here in the Philippines and in Southeast Asia. So Filipino employees ranked in Southeast Asia were actually the first in daily stress. So we have countries such as Philippines, Thailand, Cambodia, Myanmar, Vietnam, Singapore, Laos, and also Malaysia and Indonesia for the stress levels. On a second on the daily sadness, and third on daily anger. Probably what contributes a lot to this is also how public spaces here in the Philippines are also structured. It's a very stressful place to live in, as Albert would know, especially living here in the Philippines. Whether it has public infrastructures, that's why it's also very important to have healthy public spaces in that sense, even parks or natural parks and everything, which is something that's very difficult to actually access here in the Philippines. It's really about the difficulty for urban planning, how highways or traffic is done, which really spikes up the stress levels, the daily stress levels here in the Philippines. The next one is we move on to schools and students. So 1 in 5 university students suffer from a mental disorder in every given year. Only 16% of these students were able to access treatment during the given year. Studies show how high burden of mental health problems among university students of ASEAN countries with depression, anxiety, and addictive behaviors being the most prominent problems as well. So for the case of mental health investment, there's actually annual economic cost of mental health conditions due to absenteeism, reduced productivity, and premature death of around 68.9 billion pesos. And I'd like to introduce something that Empath as a social enterprise follows, which is a framework, which is the dimensions of accessibility. So with this case, there is societal beliefs, geographical, financial, information, efficiency, and contextualization. So a lot of people recognize when it comes to inaccessibility or difficulty to access mental health care would be usually the financial and geographical, meaning the costly rates for this, how expensive or difficult it would be to pay for a certain session or even medication. The next one would be geographical because in the Philippines, it's highly concentrated in the city or Metro Manila and not necessarily those that are outside the Metro Manila area. And for this one, the geographical, they definitely has cost barriers. So let's say many psychologists are just concentrated in one urban area, which would be in Luzon. And then for the rest remaining regions of the Philippines, it's very difficult to find access. So sometimes they even have to fly a psychologist there, take a 2 to 3 hour drive there, and makes it all the more difficult. So for this case, this is the more, I guess, like obvious type of barriers for accessibility, and it's correct. It is very valid. It's correct. It's a valid concern, definitely, when it comes to getting and reaching accessibility for mental health care. The next one we have, which is the societal beliefs. So for societal beliefs, it's includes stigma and misconception. So let's say an individual has enough financial funding to pay for a session, to pay for medication. They do have the money, an allowance for it, but when it comes to their stigma, they don't think that they should go out to reach into an expert or bring themselves to access mental health care, mainly because of societal beliefs. They take it as like, I shouldn't do it. It will make me crazy person. It will label me. Oh, I don't think my problems are valid enough to reach out to an expert. So because of these things, it serves as a barrier for them to even accessing it. So let's say they live in Metro Manila, they can easily go to a psychologist, they have the financial funding, but because of societal beliefs, it prevents them. It serves as a barrier for them to reach out to a therapist and access mental health care. The next one is information. So let's say we have someone who's financially capable to buy a session or to support themselves financially, and they already took down the barrier of misconceptions. Their family is very supportive. They are open definitely to seeking out therapy. But when it comes to information, they don't know where to go, who to access, what's the difference between a psychologist and psychiatrist, who do they go to for the start. When they search on Google, there's not much things on how to go about it. So for the information wise, being them informed how to navigate their way through the mental health care system, like do they take medication, do they not, do they go psychotherapy, do they do expressive arts therapy? So this is something that they are willing to do, but because they just don't know what to do because it was never taught in the curriculum and education, nobody really talks about it or informs them about how to go about it, then it also serves as another barrier for accessibility. The next one, which would be efficiency. So for efficiency here in the Philippines, it would take, usually the turnaround would be the next session. So from your first therapy session or second or third therapy session, the next following session would take even an average of around 2 months or even more. There are some psychologists that would actually take a whole year for you to even book your next session. This is also due how traditional the system is, in the clinical traditional system is here in the Philippines when it comes to psychosocial care and psychotherapy. At the same time, also the limited resources of mental health professionals. And the efficiency part definitely serves as a barrier. So let's say you have the financial support, you take out the misconceptions, you know who to go to, you got a good referral and recommendation. But to regularly get therapy that you need the most, because it needs to be in a consistent program, you won't be able to access it because it takes such a long waiting time, and it's not able to consistently get it. So it causes friction for you to be able to access that mental health care that you need. Last but not the least, it includes contextualization. For contextualization, a lot of psychology is very Western based. It's very highly underdeveloped when it comes to the practice of psychology especially in Southeast Asia. So sometimes when they're Western based researches and developments, they try to apply it here in Asian countries or even the culture, but it's very difficult. So there definitely needs to have a lot more investment for research and development and contextualize, more inclusive to specific cultures, more inclusive to approaches and techniques. Like for example, in Western-based psychology, it's very individualistic, but then for Philippines, it's very collectivism type of setup. So very family-oriented environment. They definitely get affected with the people they surround themselves with. So it takes different approaches. Like group therapy has been shown very impactful for that type of culture and really bringing to the conversation of a more inclusive psychology practice to cater to different cultures and very unique contextualizations. So in the Philippines, which has been a celebratory milestone for back in 2018, which would be the passing and the enactment of the mental health law here in the Philippines, RA 111036. It's an act establishing a national mental health for the purpose of enhancing the delivery of integrated mental health services, promoting and protecting the rights of persons utilizing psychosocial health services, appropriating funds therefore, and other purposes. So in this case, for the mental health law, it mandates workplaces, schools, and also local government units to have their own mental health support programs and services as well to help build the mental well-being of the community. And this is a really great initiative that's been established within like our government and our community, but it definitely has a long way to go when it comes to execution. And first, let's say one thing would be great to have one thing as a law and for it to be signed on as a law, but it's another feat to have it executed and acted. So because of this and also the current difficulties in the pandemic, especially here in the Philippines, and the impacts of it psychologically for many Filipinos, I decided to launch Empath back in 2020. So going back to what Empath stands for is that we aim to have accessible mental health care solutions and services for schools, workplaces, and nonprofits that are in need of improving their community's well-being. And because of this, it was inspired by what actually needs to be aligned and enacted by the mental health law. So DOLE, which would be the Department of Labor and Employment, or even DepEd, Department of Education here in the Philippines. Let's say, for example, having mental health policies and programs part of the curriculum. So young children, you start them young and they can educate them about mental health. Just how they have, let's say, basic health class or physical education, they also have mental health education. And it includes, let's say, policy development, safety policy development for mental health, inclusive mental health disabilities. And for example, a sample of what, let's say, Empath, the end-to-end comprehensive support 12-month program would be the telemental health consultations, can include family members, quality assurance systems, tech-enabled psychological assessments, online learning, online wellness and fitness classes, and even the mental health pharmacy for free deliveries directly to their home. So it includes comprehensive, high capacity, contextualization, client responsive, high quality, and reliability. So for this case, for example, client responsive is we even have psychologists and therapists that know Filipino Sign Language or even different dialects in the Philippines because we're very multicultural also. And it makes it easier for people to relate if they can speak in their own dialect rather than directly into English, for example. So what we can do next is that we can definitely, after this talk, we can definitely aim to work on these certain goals of how we can contribute to a more inclusive world and region for when it comes to mental health. So engage in discussions on mental health awareness and then the need for more community-centered mental health programs and initiatives advocate for cultural and contextualized research and development, so more inclusive research and development under the practice of psychology, incorporate mental health inclusive policies and efforts in workplaces, schools, and other spaces. So there, hopefully you were able to take away a thing or two for this, and thank you for having me this morning.
Thank you, Steph. It was very, very insightful and contextual. It was certainly something that is, I'm sure not many people have known that how the Philippines has actually moved, particularly the mental health law. On that, how many countries can actually boast about having this? Of course, it's one thing about having it, but another thing implementing it. I like to just welcome anyone who's got some questions or would like to actually if there's a certain burning question they like to do, we'll go to the plenary later, or if there's they like to raise their hand on this element. Is there anything, Albert? Besides, I posted some things just to get people thinking. Maybe you could just read out what I asked, Albert.
Yeah. So I'll start from the bottom and work my way up. One of the questions that was posed was, are mental health experts trained mostly in Western countries, or are they trained in Southeast Asia? Steph, I don't know if you have the answer to this question, but maybe we can also hear from the participants who are also here in the room, what your backgrounds are and where you might have been trained in. So please type them in the chat. Some other food for thought. What about the minority religious communities in Philippines? What is their experience? How different is their mental health challenges compared to the majority Catholic society? So I just put those two questions together, Steph. You can answer them all at once or one by one.
Yeah, sure. I think these are really great questions and definitely important to include in the discussion. Maybe I can start first with are there mental health experts trained mostly in Western countries, or are they trained in Southeast Asia? I might not know the specific statistics of the demographics of where majority of the mental health professionals are, but let's say based on how open as it is to have mental health experts and psychologists, because it also does affect if the people want to pursue a psych field. Definitely there is a scarcity of it here in Southeast Asia. And mainly, this is just an assumption already, we can just double check about the statistics, but it's just based on the cultural differences and acceptance rate of mental health. So definitely is more acceptable. Still a long way to go with the stigma. Definitely more acceptable in Western countries, mainly because they also have a more developed practice of psychology. So there's larger acceptance, and it's very easy for some of them to casually bring up, oh, my therapist at ABC, or like my therapist thought about this. But then for us, which I hope in the future we can casually talk about us having therapists as if it's like a dentist. Oh, I visited the dentist recently. I had like my annual checkup or something like that. Definitely, this is an assumption, but based on cultural context, definitely a scarcity when it comes to the Southeast Asia region. And I think there's another good question. What about the minority religious communities in the Philippines? What is their experience? How different is their mental health challenges compared to the majority Catholic society? So minority religious communities, for other than Roman Catholic, is there anything that you have in mind? Like, for example, there's also the like other religious. If you have any mind specifically, I think because the minority ones other would be either let's say for when it comes to other Christianity, or let's say the ones in Mindanao. So I can't for say or the ones in Mindanao, which is for like Muslim, or let's say Islamic, for example. That's also a different context. That one I'm not sure per se, but then definitely for the Christian community, it might have similar parallelisms also when it comes to the majority of Catholic society. So it's really like, oh, just pray about your experiences, or there is a notion that you're not praying hard enough, or your relationship with God is not that healthy. So which definitely I think I saw in the comments there. Yes, I agree with Rosie. You need to pray about it is oversimplistic and causes people to hide their pain. I'm a Christian and believe in prayer, but the patriarchy and suppression of Christian culture is dramatic. Yes, it definitely can be. But what I appreciate lately, because of the pandemic specifically, I noticed some religious groups are seeing the alignment, like it's not a counter thing, like seeing the alignment about importance for mental health and spiritual health. So ideally, like they should go hand in hand in that sense with for those, let's say, who prefer like religious and spiritual paths also. So hopefully this is something that can further on the movement that spirituality is not supposed to hinder mental health care accessibility, and it's supposed to complement it, or like if you prefer a more religious type of path. So for I think there's other questions.
There's one more from Nicole. Hi, Nicole. Do people talk about well-being more holistically or just mental health?
Sorry, by people, which depends, which maybe country or region are you referring to, or specifically in the Philippines?
I guess just broadly Southeast Asia, and then maybe specifically in the Philippines, if you've got any kind of insights.
Yeah. Yes, thank you so much about that. Actually, yes, for well-being more holistically, that's definitely a movement. I feel like that goes hand in hand with the mental health. I think why they also bring that conversation, because well-being more holistic well-being sounds less intimidating for Filipinos than mental health in that sense. So they do definitely talk about, I feel like some even prefer call it holistic well-being over mental health for some, because it seems less intimidating to them.
Okay, great. We'll take one more from Rosie before we go to No. So Rosie.
Thank you. Hi, Steph. I'm
Hi.
a trauma-informed coach, and I'm studying to get my trauma recovery coaching certification. I totally see the intersections between trauma, intergenerational trauma, inequity, racism, colonialism, which I know the Philippines has experienced a lot of, and then the impacts on our mental health and well-being. I'm wondering, for the Philippines at least, how do you see any integration, I guess, or how accepted is the idea of trauma and being traumatized? Because I also feel like there's a lot of stigma around admitting it or recognizing it, which prevents people from healing. So I'm curious how it all comes together in the Philippines.
Yeah, definitely, especially with intergenerational trauma. There's a lot of invalidation when it comes to traumatic events. I think because it's such a norm to be traumatized for these things for them. So they're like, oh, I've gone through it. Just because majority of the people or a lot of people gone through it doesn't make it invalid. Mainly because like the notion or the thinking is that, oh, I've gone through it, I turned out fine. But sometimes maybe they didn't, like maybe they've suffered from substance abuse or irritability or anger issues. It comes in different names. What I usually mention is that maybe because like they never really got mental health care, so maybe they do have it, but they're just not diagnosed. So there is definitely a notion about trauma, but it is a conversation that is talked about more in Gen Z and millennials. And because we're rising dominantly in the population, because I guess work population and the other generations are getting older, in that sense, there's slowly started a recognition for it, but definitely there's a stigma that, oh, I've went through it, I turned out fine in that sense. Invalidation's very much there, mainly because so many people have gone through it in that sense, but it doesn't make it any less. Like just because a lot of people have experienced trauma and live different lives with it shouldn't invalidate it. Even like social, cultural, intergenerational, and it's quite difficult living in the country in the Philippines. We go through a lot, from colonialism, from how the history of our country, from very little things, like with colonialism, even when it comes to beauty or the standards, like it's shame to have to be morena. So that's a term for the Philippines, morena. It's like to have this very rich chocolate type of skin, in that sense. So that even adds pressure and causes, let's say, bleaching, also bleaching of their own skin. So it develops a variety of mental health concerns. And unfortunately, let's say even poverty is a very severe, very dominant thing here in the Philippines. And like, oh, everyone here is like, so many people are undergoing through poverty. So they try to invalidate that. It doesn't make it any less traumatic, because it is a very difficult thing to live through, definitely. So that's just for the context, at least, that I can say about the Philippines.
Thank
Great.
you. Yeah, it's about as complicated as I thought it would be. So thank you for sharing your thoughts. I appreciate it.
Thank you, Rosie, for that question, and thank you, Steph, for responding. Really appreciate that. We'll go to the plenary, and then we can actually go into a little bit more, take a deeper dive. So we'll now take it and invite Noor to give his insights. And right now, you had the Filipino perspective. Now we're going to have a Malaysian perspective, more from a business case. So over to you, Noor. You introduce yourself and take it from there. Over to you.
Good morning, all. Let me share my screen first. Okay, good morning, everyone. Thank you, Sudeep and Albert. First of all, my name is Noor Iskandar. First, I would like to let everyone know that I'm not a mental health practitioner, and I'm not a mental health consultant, and I'm not even a mental health subject matter expert. I'm just a strategic consultant to companies of diverse industries in many different countries around the world, and I have more than 30 years of experience in management. I work closely, basically, with the board of directors and management to formulate business strategies and assist them on their implementation. The keyword is implementation. I believe mental health awareness is something that many executives overlook, but it's vital leadership skill that is necessary for the long-term success of any organization. Now, basically today, what I want to talk about is workplace mental health in Malaysia, the business cost. Basically, my presentations are going to be in two parts. Part one is where I'm going to talk about the statistics, basically the statistics of mental health condition in Malaysia with regards to productivity. And then the second part will be the experience that I have encountered during the implementation. Now, on the first slides, basically mental health, as everyone knows, always referred to as an invisible illness, but there are heavy costs to individual health, family and friends, and even organizations and companies. And according to the 2020 National Health Mobility Survey, 1 in 3 Malaysian workforce grapples with mental health conditions. This is actually very critical, 1 in 3. And with this context, organizations, 29% of workers on average will experience poor mental health with symptoms of depression, anxiety, or work stress, and even burnout. These are very, we call it damaging information, and the cost of these mental health issues due to all this contribute to estimated about 14.46 billion ringgit, which is equivalent to about $3.26 billion, about 1% of GDP in 2020. Now, I believe in 2021, 22, the numbers will be even higher post-COVID events. Now, Malaysia estimates the cost of poor mental health by looking at how it affects productivity in the 3 main areas. One, staff turnover. Normally, staff turnover will always relate to personal change of job for higher pay, better benefits, new challenges, and even promotions. Never thought that it's due to poor mental health. And as you can see, it costs about 1.34 billion ringgit in Malaysia for staff turnover. Next, which is absenteeism. And again, absenteeism will always relate to sickness, health issues, personal problem, or just plain lazy to go to work, And it costs about 3.28 billion ringgit, which is quite a significant number. And worst of them all is presentism. Presentism is 9.84 billion ringgit that caused productivity loss to the Malaysian economy. Now, I want to dive into what is presentism is all about. For those who knows, I'm just refreshing everyone's memory. Basically, presentism refers to the loss of productivity that occurs when employees are not fully functioning in the workplace because of illness, injury, or other conditions such as mental health. Now, even though the employee may be physical at work, they may not be able to perform their duties and more likely to make mistake on the job. Now, although presenteeism tend to be admired or encouraged due to work cultures, work hard, commitment, and so forth, but it costs the organization 3 times more than absenteeism. So these are the numbers that organizations or corporations need to look into. Now, in my next slides shows that the productivity cost of mental health issues as an individual. If you can see there, it costs about 946 ringgit. That's about $220 per annum that costs the company due to mental health issues. Now, as an individual, if you look at the numbers, it doesn't mean that much. But if you look at this issue at the organization level, I can share you with this. If you can see Petronas. Petronas is actually a Malaysian national petroleum company. They are same like Aramco in Saudi Arabia or Pertamina in Indonesia. They have over average number of employees of 48,000. And with 48,000, the total cost or the total productivity loss is at 123 million ringgit a year. It's about 27.7 million US dollars. It's a very significant number, a very significant hit to the profit and loss. Yeah, the same goes by Nestle. I think everyone knows Nestle worldwide, but for this instance, it's Nestle Malaysia. It's about, they have about 5,000 number of employees. It affect them almost 13 million ringgit or USD 3 million. So again, this number is quite significant and affect the bottom line. So part 2, I will talk more about the experience. Looking at the statistic presented in part 1, organizations start to look for solutions and answers. And the organization that I used to work with experienced this during the implementation and on how to address the issue of this workplace mental health. As you know, mental health subjects are quite new to this region and of course in Malaysia as well. So they start to look for answer, they start to look for solution. But before that, the first question they need to answer is that they have to acknowledge that the mental health issues do exist in their organization or do exist in our organization before we can find the right answer or the right solutions. Secondly, everyone have to acknowledge it has a big impact on organization work culture and bottom line. So what do we do first? So you guessed it, as usual, Board of Directors created task force to address this issue head on. The members, of course, comprise of top management and head of departments, meetings after meetings and more meetings, days after days. And finally, the task force came up with a program and campaign. Now, the program was introduced and launched across the organization, hoping to reduce the problem of absenteeism, presenteeism, and staff turnover. As you can see, the organization came up with 3 main programs, which one, we call it universal program, which is actually awareness. Come up with, we call it preventive module, which is targeted programs. And lastly, more corrective action, which is treatment programs. So all this program was introduced and launched across the organization. But we fail. We fail because we fail to achieve the target and objectives that we set for the organization. Absenteeism is at the same level, turnover are still high, presenteeism on the rise, and the organization as a whole go back to what is before the program was launched, back to the norms, And then we start to answer the question, we start to ask ourselves, why? Why does it happen, So why does it happen? Why is because we fail because the task force only identify programs that organization want, not what the organization need. So and also members of the task force comprise of internal personnel which have no experience and not qualified in handling workplace mental health issues. This, in fact, is very, very crucial in an organization. So what do we do? So what's next? So we engage a certified and qualified mental health consultant to do an assessment and guide us to design a program that suits our needs. Now, the keyword there are certified and qualified mental health consultants, because nowadays there's so many so-called mental health consultants, but they are not certified and qualified. We need to be aware of that, you know. So what's next? So the consultants guide us first to consider the diversity of our workforce. Basically, no two people are the same, and people diverse and are very complex, and people are more likely to struggle with mental health, varying from their culture, ethnicity, by age, and by gender, and also by their lifestyle factors such as their living situation, their debt levels, hobbies, and exercise routine. And all these can impact someone's emotional and mental state as well. As such, to ensure that mental health strategies catered for this diversity of the workforce can help employers shape a strategy which provides a targeted support for the whole of the workforce. Next, the consultants point out that we need to ensure equity, not just equality. As obvious, but often overlooked, different people require different solutions, similar to physical health as well. For some individuals, support may be focused around maintaining on their mental health and well-being, education, mindful technique. But some may be at early stage of struggling, where culture of speak up and looking out for another is really beneficial. And some may have acute chronic mental ill health, which needs support from trained line managers and HR to help these people remain productive at work. So to sum up, it is valuable to have appropriate support for employees, no matter where they may be on the mental well-being spectrum. So that is very, very important. And next, we have to take an inclusive approach in the organization. Now, the inclusive approach that need to flow across the hierarchy, leading from the top all the way to the bottom to help set the cultural tone for open discussion, for more open discussions about mental health and well-being, plus the support that's available. Visible leadership, engagement and support on the topic helps to build culture of trust, security, and inclusion. Now, taking into all these elements into our program, we come up with a more improved and enhanced type of support to improve mental health at workplace. And as you can see, for targeted programs, or we call it more preventive, we organize basically a mental health first aid program, working towards where people in organization has the first aid skills to identify and support people with mental health problems. Now, these programs are organized by a worldwide organization which are available, I think, in most countries around the world. Now, as far as for the treatment programs, what we call it more corrective action, we add on what we call it employee assistance programs, or EAP, offering services including counseling sessions, psychoeducations, and also paid leave so that the employees can cope with their mental health. Now, the most important questions that the organization will ask is, what is the ROI when you do all this? Now, based on our experience, based on a conservative estimate of campaign success rate of just 10% in terms of change, average at a return on investment was 12.6. For instance, a campaign cost of about 100,000 ringgit, or $23,000, with only 10 success rate, the return investment will be at 1.26 million ringgit, or about $300,000. Now, this ROI was primarily attributed to resultant in increase of productivity, organization awareness, knowledge, alongside decrease in mental health stigma. So when organizations see this sort of ROI, they were to start to invest in this program. Now, In conclusion, the holistic approach that we have taken to address the issue of mental health at our workplace, guided by certified and qualified mental health consultant, have resulted in improving in the area of absenteeism, presenteeism, and staff turnover in our organization, and significantly reduce our workplace mental health costs. But there's still more to be done, and the journey has just started. Now, on my last slides, I put up that in Malaysia, we have this, what we call it, the National Strategic Plan for Mental Health, a 5-year plan. And this program was driven aggressively by our previous health ministry, Karis Jamaluddin, said that Ministry of Health has a long-term policy to improve the country's mental health services, prepared by mental health experts after taking input from various stakeholders into account. He's one of the best of our health minister, and we hope that his legacy will be taken by the new health minister. With that, I thank you for your attention. All the best.
Thank you, Noah, for your definitely the business case perspective. It was very, very insightful. I'm now going to once again just open it up just for 1 or 2 questions. Over to you, Albert. Are there anyone like to raise their hand on the subject that Noah had actually shared? Any questions?
Yeah, so aside from the provocations that you've posted in the chat, which we'll also get to in a bit, let me kick off with a question from Rosie, who's asking for the calculation of the ROI. How was success defined? Nor?
Oh, okay. It's more on towards the bottom line. Basically, when you reduce absenteeism, you increase productivity. And then when you reduce high turnover, the cost of training new staff or new workers will reduce. Yeah, so you get more productivity from them. And of course, you also reduce presenteeism in the organization, where when people are sick or they have issues, they won't participate in the team, so that the team will progress in what I call it, more 100% more, rather than carry the person that have these issues. So bottom line, it does shows in your profit and loss. You just need to quantify it, and different companies have different ways of quantifying the numbers.
Thank you. I think, please correct me, but I think you're talking about more how the ROI is calculated. And I was, because in the slide you showed that with only a 10% success rate, the ROI was estimated to be something like 26%, if I'm remembering correctly.
Yeah.
So I was wondering, what do you mean by a 10% success rate? Like a success of the people recovering from mental illness?
Yes,
or
yes, the 10%. So of course, obviously, when you do something, you expect 100% returns in that manner. But we discovered that even with 10% success rate, it gives a huge impact to the organization. Because one thing, that 10% can multiply to be more, because the awareness are there and people start to more open talking about mental health in the organization, rather than keep themselves in the closet. So that give the company or the HR to become more proactive addressing the issue, rather than looking for the issues.
I see. So that's what I was trying to get clarity on, was like speaking, I have depression and anxiety, and I've been under treatment for many years, like 5 years at least, something like that. And so I don't know how I would define success, right? Like success depends. Actually, I wouldn't even use the word success. It's just how I feel it's day to day. So that's why I wonder, especially in a business context. I have a business background as well, and I was in HR. So I completely understand the need to demonstrate some kind of monetary ROI to companies, what have you. But I feel like there's a lot of caution needs to be had in using words like success rate, especially when it comes to people's health and wellness, and particularly in an area that's not very well understood still. So could you say a little bit more about what is meant by success and what 10%
Okay.
success looks like?
Now, the success is not so much for the money. Yeah, the success is more to make the organization acknowledge that these issues do exist in their organization. Now, normally, organization won't do anything unless there's something in returns happen to them. So by showing them, or the organization, the board of directors, the shareholders, or the stakeholders of this sort of return, at the same time, give them in terms of bottom line returns, they wouldn't hesitate to invest into the people of their organization. So these are tools more not to say that it's a success to the person that having the issues, but what we want to encourage organization to look into this seriously, not just doing this a piece of meal, just for public relation, but to look seriously because it does help their organization as in general. So that is the whole exercise. So with that, when you present to them, they look like, wow, okay, we need to do this. So the awareness brings the organization commitment. That's what the whole exercise is all about.
I see. So it's more of an example to illustrate if there was success, this is what the ROI would look like. Is that what you mean?
Yes,
Okay,
correct.
Thank you.
Yeah.
Thank you for clarifying.
Thanks, Rosie, for that question. Along the same lines of being careful with your language, Will also has a similar remark in the chat box where he mentioned that it's also important to look at mental health and well-being, and that they're not always the same. Someone may be extremely demotivated at work through burnout, and that may have significant mental health impact. However, the same demotivated individual may have a lack of autonomy within the organization, and well-being or positive psychology or behavioral organizational psychology has more of an impact than counseling or clinical psychology. Will, is there anything else that you wanted to add to this comment that you put in the chat?
Let's see, I see Will in the Will. Okay.
Yeah.
Will has made his comments. I'm glad he actually shared that. That's very useful.
Yeah, thank you.
Yeah. All right. So there were some other things I put in here just to get people to think, but I think the point was also just to see about and that's something we can just talk in the plenary a little later. But does anybody else have anything that they feel before we move on to Manasi? Okay, Will's in a quiet space. Great. All right. All right. Okay. So we will get into a little bit more detail. Thank you very much, No, from the business perspective. It's always useful to actually have this because when you want to bring this into a business case, it's always talking about the economics and the money and making it sense for the stakeholders and the investors. So that was very important. Now let's now go into more of a personal account and get an insight from India, in particularly from Manasi. So over to you, Manasi.
Thank you so much. Please confirm whether my screen is visible.
We can see your screen.
Okay. Thank you so much. So my perspective here is to share how I've grown as an individual and how we have grown as an organization.
Sorry, Manasi, it's on loading still. We don't see, suddenly it's a dark screen in front of us.
Is this visible with the slides?
Hold on. Can you move your slides?
Yes. Are my slides visible?
Yeah, you can do that because I think early on, yeah.
Yeah, I'll prefer this. I think it takes a while to load in slideshow.
Yes.
So Yes. So, hi, everybody. Thank you so much for having me. And here I would like to share my journey of leading Use of the Mind Foundation to advocating mental health in India and to just understanding how all of us can lead our different projects and initiatives about the causes that we care. So, here's the flow of the session. Firstly, I'll briefly share an introduction so you know more about the work that I do and what I stand for. Then, secondly, we'll focus on the power of why, and why focusing on the reason behind our initiatives is the biggest sort of catalyst to change. And thirdly, what is the need of even working for mental well-being in India? What are the pain points, and what are the things that really sort of challenge people in India in when it comes to mental health? Fourth, here are some of the things that really matter in the process, whether it's the people, the idea, and the team that we work with, or the decisions that we take. What influences all of this? And fifth, on a personal level, the different habits that we can build to be more consistent in our efforts, and why even consistency is important in the process. At the end, I'll also share some future avenues that you can explore to volunteer, to sort of have to build change in your own way, and to be involved in many different initiatives. So without further ado, I'll begin. And firstly, I would like to begin by sharing stories. And why this is important is because at Hues of the Mind, we also began as a platform to share our stories. We can all acknowledge that the stigma around mental health is shattering and very staggering. And one thing that helped us break that stigma in our local community was to share our stories of struggle and well-being. So in terms of my timeline, I am an engineer by profession, but I was uncertain on how to leverage these skills when it came to social impact. And I wanted to focus on delivering or giving back to the community at the end of the day, but I did not know how to leverage technology for the same. The following year, I founded Use of the Mind, and I recognized the need to talk about mental health when it comes to the youth who go through a lot of challenges, or even children who might not even have educational resources about mental health. So I recognized this need and worked on different digital tools to make this come true. We started as an online community in the beginning, and we were present on social media platforms. And then we built platforms such as a repository of mental health professionals, such as online support groups, and so on and so forth, to make these resources more accessible. And our testament, the recognition that we've got is a testament to our passion for the cause, and we continue to keep learning and growing. For me, I would say that I am an unconventional entrepreneur. And when I started, I wasn't very sure of what our long-term, what our fixed goal was, or what our plan was. But I was clear about our long-term goal, which was to break the stigma around mental health and help people help themselves. So some things that really helped me in this process were consistent efforts. And that might be as simple as maybe talking to people about mental health. For example, how all of us have come here today to talk about different aspects of DE&I as well. The second aspect was to keep doing, learning from it, and we witness what works for us and what doesn't work for us. And that is where unlearning and relearning came into picture. So focusing on building something and just building a feedback mechanism of sorts. The third aspect here was really crucial, because I feel that whenever we start a project or an initiative, we expect results to come in very quickly, but focusing on the process more and not on the results or the outcomes or the return that we were getting in the short term really helped us be more consistent and give our best to the process. The last was empathizing with not just our audience, but with our members, understanding why they are motivated to work for the causes that they are working for, and to align with them to have a common vision for the organization. Next, I wanted to touch upon why finding our why is important. As you can say, it says find your why and you'll find your way. So, for example, you're passionate about achieving equity for women in your organization. And maybe there's also a personal sort of aspect to it. There's a motivation which might have come from any first-hand or second-hand experiences. But just reflecting on our why can really help us go the longer distance. And here are some ideas for that. So focusing on the why helps us be more self-aware. It helps us be clear on why do we want to do something and why are we doing it? What is the actual motivation behind it? Then as we're clear on the same, and this awareness can, of course, have a lot of different dimensions. It can be, for example, making the workplace a better place to work in, or it can also be to sort of helping people progress in your community. It can have a lot of dimensions. And then initiation, understanding our why can help us develop a plan of action, whether it's market research that we want to do, whether it's people that we want to interview one-on-one. How do we want to go about it to understand the problem that we are focusing on? And thirdly, collaboration. Right now, as we've all come here to collaborate for different causes, collaboration to work for a particular cause definitely comes in when we're aware on why we're doing what we're doing. And this can be in the form of team members or just getting in touch with different stakeholders. So the next is why social impact, or why mental health in particular. Why did I focus on that? So here I've presented some statistics. So we had a national survey in 2016 where the first result came up that nearly 14% of India's population required active therapeutic interventions. And the sad reality is that the treatment gap in our country varies from about 70 to 92%. The second statistic that is also, concerning is that 20% of Indians suffer from mental diseases by the end of 2022. So just in a gap of about, I would say, 5 years, you can see there's an increase in the number of Indians that require mental health intervention. And the last statistic also reflects the same. So we can see that there is definitely a need to provide accessible and affordable mental health care. And in 2019, when we began, this was our motivation to work for mental well-being. Firstly was the lack of accessible and affordable resources. As I just mentioned, the treatment gap is really, really huge. And the gap can also be due to a lot of reasons. It can be due to financial inaccessibility. And as Steph also touched upon, a lot of different dimensions, I think they also resonate with our communities in India. The second aspect was the lack of dialogue. So we are not taught about mental health in our educational curriculum in schools or colleges. And this brings about a big sort of challenge in dealing with our emotions or coping with situations which might be stressful on an everyday basis. So there's a huge lack of education, which also contributes to the staggering stigma that we have around mental health. And the third aspect was that we saw that there were not a lot of nonprofits working in this area to give back to the community. And all of these sort of had a holistic approach for us to work for mental well-being and to advocate mental health in India. So just taking the scenario, the problem that I've mentioned, a staggering treatment gap of about 70 to 90%. And some solutions that we aligned with or based on that were, for example, having resources for education free of cost, whether it's in the form of workshops, that is live participation, or passive participation in terms of having a podcast or a newsletter, but just to make our audiences aware about mental health and education in general. So in the process, what were the things that truly mattered? Firstly, as I mentioned, the cause itself. how passionate we are towards it, what is our motivation to work for it. Secondly, the team. Understanding their motivation and their why goes a long way. Thirdly, innovation, to sort of leverage technology and different things in order to keep innovating and making our solutions better. The fourth is the ability to keep learning and adapting. I'm sure today as well, we would have learned a lot of different perspectives in the talks of the different panelists. So just to learn from it and adapt in the approaches that we have currently. Then a consistent and structured approach with a feedback mechanism. And the values that truly made a difference when we talk about mental health, whether it's in terms of the communications that we do or the people we are. Firstly was a lot of courage. When we talk about mental health, it's not easy to come forward and talk about our experiences or create that safe sharing space. And these ingredients really help us foster that space, courage, empathy, to understand each other, to be there for each other, kindness, a lot of patience in the process of delivering the project and in the process of receiving help as well. Inclusivity, to help people truly be their authentic and true selves, and a lot of consistency. Next, I would also like to touch upon the Atomic Habits, as you would have heard of this very popular book. There's also Atomic Habits cheat sheet that I can share with you after the presentation. So here are some of the things that worked for me as a founder, and it can also help you as you lead different initiatives. So for example, having those daily goals that we want to achieve, whether it's as simple as just exploring something for mental well-being in terms of going for a conference, then having accountability for those initiatives, then building a momentum with these habits that we've had. And also, as I keep mentioning, having a growth mindset to learn from this. And discipline, a lot of discipline to keep showing up when we don't see results, to keep improving from all the experiences that we've learned. Next, I would like to briefly touch upon the different resources that you can potentially sort of have a look at to inspire you in your journey of innovation. So the first one is Youth Lead, and here we can register as members and be a part of different causes that we care about, whether it's climate action, whether it's education, or specifically mental well-being too. Then we receive a lot of resources when it comes to webinars or conferences, grants, funding, a lot of different things to actually be more involved in the cause that we care about. The next one is ISEC. So ISEC is the world's largest youth-run organization. And since our target audience has been the youth, ISEC has really helped us truly focus on delivering impact to them. And we've collaborated with ISEC in multiple occasions and multiple countries. The next one is One Young World. One Young World is the best platform that I've come across to actually meet change makers and passionate social entrepreneurs from all across the globe. It's a platform that brings people annually in a conference for about 3 to 4 days and has been the most insightful experience for me so far. Next is collaborating with nonprofit organizations locally or even globally. That can bring in a lot of perspective to understand what is the work being done in the cause that you want to work for at the moment. Then fellowships also go a long way, and I feel that I've personally learned a lot from being a part of different fellowships in terms of different aspects. And the last one is volunteering. It can be as simple as learning to doing a course to be a more empathetic listener, or to actually help in fundraising, but just helping us devote our energy and time to something that we care about can provide more meaning to whatever we do. And with that, I'll conclude, and I'll just like to share that please feel welcome to reach out to us at any point of time. We are Hues of the Mind Foundation. We're available on Instagram, LinkedIn, and Twitter. And our website is live with a lot of resources that are free of cost. We have a self-care kits as well. If you ever want to access it, please feel welcome to message me. And here is my personal, sort of contact as well. Thank you so much for listening to me and having me here.
Thank you, Manasi, and thank you for sharing your from the personal angle and how you actually set up and how you actually went through from that mental health perspective and trying to